Hello everyone, my name is Parinaz Roshanzamir. I am a master's student at Concordia University, Canada, and today I'll present our work on how inter-rater variability relates to aleatoric and epistemic uncertainty, a case study with deep learning-based paraspinal muscle segmentation. Medical image segmentation is a critical component of medical image analysis. Segmentation models have seen significant improvements in recent years and are being used in image-guided interventions, disease detection, and many other fields as well. Improving the credence of deep learning models used in anatomical segmentation is important now more than ever. It can facilitate the clinical implementation of models and also help mitigate the risks. However, reliability assessment of deep learning models is still a relatively new research field, and deeper investigation is required. Studying the uncertainty of deep learning models and estimating its value can serve as a valid assessment of the reliability of model outputs, and therefore it's an important venue for improving the credence of deep learning models. In the following slides, we will learn more about the categories of uncertainty and what causes each of them. In deep learning theory, uncertainty is generally classified into aleatoric and epistemic uncertainties. Aleatoric uncertainty is related to inherent factors of the data such as noise that can make the process of decision-making difficult for the model and cause uncertainty. And since it's related to the nature of the dataset, it's not reducible unless we decide to make changes to our dataset. Epistemic uncertainty, often referred to as the uncertainty of the model, is related to the model's lack of knowledge about the data and can be reduced by collecting more data or optimizing the model's architecture and training process. In medical image segmentation, there are often extreme anatomical variations among different individuals, and these variations are not reproducible by augmentation methods. This means that the model will not have enough examples of such variations to be able to properly learn them, and this lack of knowledge is another factor that can result in epistemic uncertainty. Inter-rater variability is another type of uncertainty which has recently become a topic of interest for deep learning researchers and is especially important in medical image segmentation. In supervised learning, the model learns correct prediction through a training dataset with ground truth annotations. As the model solely relies on that specific set of annotations for learning, the final model predictions will be biased towards the general annotation style of the training set. In a medical task, this would mean that the model is biased towards the opinion of a single expert. In order to overcome this issue, training datasets have been formed with annotations from multiple experts. However, potential disagreement between the raters forms probabilistic ground truths and results in uncertainty. Several factors can cause inter-rater variability. Experts may have different levels of knowledge and follow different annotation styles. Also, data noise can make the annotation difficult and cause disagreements. Therefore, we have a factor that affects both aleatoric uncertainty and inter-rater variability. On the other hand, extreme anatomical variations are another potential source of disagreement among raters, and they can also cause epistemic uncertainty as well. Understanding the relation between the uncertainties in deep learning models can help better understand model performance and reliability, and ultimately design datasets and choose learning strategies to both improve model performance and increase the reliability. After studying the factors affecting inter-rater variability and aleatoric or epistemic uncertainties, we can guess that there should be a relationship between inter-rater variability and other uncertainties. But is there really a relation? And if yes, how strong is it? Also, Since it's difficult to directly quantify inter-rater variability, can we explain the sources of inter-rater variability by using the epistemic and aleatoric uncertainty values with a method like variance partitioning? These are the questions that we want to answer in our study. Additionally, we also explore the impact of label fusion methods and model architecture on uncertainties and their correlations in our experiments. As mentioned earlier, our goal in this study is to investigate the relationship between inter-rater variability and other uncertainties. To achieve that, we use the following assessment metrics. We investigate the epistemic uncertainty with deep ensembles and test time dropout, and measure the aleatoric uncertainty with test time augmentation. We use Brier's score to measure inter-rater variability preservation, and for the correlation analysis, all correlation coefficients are calculated using Pearson correlation coefficient, and we use variance partitioning as well. And finally, segmentation accuracy is evaluated with DICE scores. In the following slides, we will explain in more details what each of these metrics are and how we have used them in our experiments. In order to quantify the inter-rater variability, we use the voxel-wise entropy for both the ground truth and the outputs. Since inter-rater variability is reflecting the differences in rater opinions, a model should ideally be able to preserve the ground truth inter-rater variability through its predictions and reflect it in the outputs. To measure the inter-rater variability preservation, we use the Brier score to compare the outputs with the average ground truth. For aleatoric uncertainty, we use test time augmentation as a method for sampling from the input distribution. This method augments each image at test time and calculates the uncertainty as the variations of the model prediction for the augmented versions of the same input presented as the entropy of the predictions. In our study, we used the output of 10 augmented versions of each image to estimate the aleatoric uncertainty. The augmentations used are random rotation, translation, intensity shift, and Gaussian noise, which are used during training as well. For epistemic uncertainty, there are two commonly employed methods for Bayesian approximation and sampling from the model's parameters distribution: test time dropout and model ensembles. We use 10 predictions sampled from the model using dropout at test time and calculate the uncertainty as the entropy of the predictions. In order to have a fair comparison, we trained 10 independent models for each task, forming model ensembles, and then used the outputs of these models similar to the outputs with test time dropout. Label fusion method in a multi-rater dataset has shown to affect the model calibration and inter-rater variability preservation. In this study, we used two different methods for integrating multi-rater annotations into our training framework. The first approach is to use majority vote of all raters as the ground truth for each image, and the second one is to randomly select the annotation of one rater at each epoch during training. In order to explore the impact of self-attention modules on uncertainty, we trained two sets of models using TransUNet and UNet as the base model architectures. With these two architectures and two label fusion methods, we trained 4 models for TTA and TTD related analysis. To achieve deep ensembles for measuring epistemic uncertainty, we also trained a set of 10 unets and a set of 10 TransUNets with majority vote ground truth. Both UNet and TransUNet models have 4 hierarchical upsampling layers in their architecture, which is necessary for a fair comparison. For TTD-related analysis, we added dropout layers to the original model architecture at every upsampling layer. Our dataset consists of a total of 673 lumbosacral T2 weighted MR images of 119 patients. The MRI scans are from 6 different disc levels. In all images, left and right multifidus and erector spinae muscles were manually segmented by 3 different raters, and the models are trained to segment these 4 paraspinal muscles. Before being segmented, all images were processed with non-local means denoising and N4 inhomogeneity correction to improve image quality. The dataset was split into train, test, and validation sets with the factors of sex and age roughly equally distributed. Accurate segmentation of paraspinal muscles is extremely helpful in long-term studies on the cause of low back pain, which is the most common musculoskeletal disorder in adults. Here are the performance results for all trained models. In every case, the superiority of TransUNet is demonstrated in the results compared to the UNet counterparts. TransUNet achieves the best performance with deep ensemble, where the DICE score is close to 95%, and the next highest DICE scores are also belong to TransUNet models trained with majority vote and random sampling. We can see that in each case, there is a performance gap of nearly 2% between the TransUNet model and its UNet counterpart. For inter-rater variability preservation, in general, there is a higher correlation between the ground truth and prediction entropies in TransUNet models compared to their UNet counterparts, indicating better preservation of the inter-rater variability, which is further demonstrated in the Briere score results as well. Same results are achieved in the comparison of models trained with random sampling label fusion and majority voting, showing higher correlation for random sampling with lower Briere scores. For the correlation between inter-rater variability and aleatoric and epistemic uncertainties, it is shown that epistemic uncertainty is more strongly associated with inter-rater variability compared to aleatoric uncertainty. This can be due to the fact that our dataset was denoised, which potentially reduces the effect of aleatoric uncertainty in the experiments. For epistemic uncertainty, random sampling results in higher correlation values compared to majority voting. And here we present the results of variance partitioning analysis. We observe that epistemic uncertainty accounts for approximately 35% of the ground truth entropy variance and with TransUNet, and almost 12% with UNet. Additionally, we observe that aleatoric uncertainty only explains a very small portion of the variance, which again can be due to the initial denoising of the dataset. In summary, the results of our experiments suggest that, in terms of correlation with inter-rater variability, epistemic uncertainty has shown to have a stronger association in our segmentation task and database, while no significant correlations with aleatoric uncertainty were found, regardless of the model choice. This can be partially explained by the fact that manual segmentations were performed based on pre-processed images with low noise levels. As variance partitioning results demonstrated, inter-rater variability is partially influenced by sources of epistemic uncertainty, which, in our study, can be anatomical variability due to pathology, but it's not noticeably influenced by data noise, which proves the importance and positive impact of optimal image processing for data annotations. The comparison of UNet and TransUNet shows that the incorporation of transformers has positive impacts in lowering the uncertainty and preserving inter-rater variability and its correlation with epistemic uncertainty, potentially leading to better segmentation accuracy as well. And finally, random sampling is proven to have a positive impact in inter-rater variability preservation, but it generally produces higher epistemic uncertainty compared to majority voting. Here is a list of all other studies that were mentioned during this presentation. And at the end, I want to thank all people who have contributed to this work and thank you for your attention. Thank you.